Maricopa County is adding staff to help track where people who test positive for COVID-19 have been and with whom they've come in contact. The county received $398 million from the CARES Act. Part of that money will increase the number of health inspectors, contributing to the county's contact tracing of COVID-19.
We're currently working on scaling up our capacity from where we are now to 8 to 10 times that capacity.
So right now there are about 25 health inspectors for the entire county. Those federal dollars would also go into buying more protective equipment for healthcare workers.
To offer more insight into the county's announcement and other big headlines in Arizona's response, we're talking once again with Wendy Smith-Reeve, ABC 15 analyst and the former state director of emergency management. And Wendy, the ability to perform contact tracing certainly is helpful as far as we take next steps, but it's also one of the requirements put out by the president. What does the state have to do here before we can start easing some of these restrictions?
Great, thanks, Steve. So I agree that it was part of the national advisory that went out from the president last week. It's part of the core state preparedness responsibilities to be able to do contact tracing for any positive patient. So as Dr. Sonnenschein had mentioned today in her briefing, those infectious disease investigators and the process of the investigation is quite extensive. And so the 25 individuals that they have right now, their ability to ramp up quickly is going to be critical given the number of cases that we're seeing in Maricopa County.
Certainly we're learning about these standing orders, and certainly the rules are relaxed so that more people who want a test can actually get one. But that still doesn't necessarily solve the problems of things like PPE and actual testing supplies and availability. Do we have enough of this to really perform tests on a large scale?
You know, I think that it was mentioned in Dr. Chris's blog today that Nicole was just talking about that basically said that we're looking to, and the facilities that are going to be performing the tests are saying that they have the supplies necessary. That is one of the things that they are going to be required to have in order to ramp up the number of tests that they're going to be able to safely perform.
Today we heard from the governor and wildland fire officials as well, talking about the outlook for the upcoming fire season. And it includes how COVID-19 actually changes the strategy, especially for firefighters on the ground when it comes to fighting these blazes. What were some of the takeaways that you had from that briefing?
Certainly, it was a quality briefing, and it was great to hear about the hazardous fuel reduction methods that have been put in place throughout the year whenever possible. John Truitt had mentioned, that this is really going to be their most challenging season due to the COVID-19 protocols that they need to have in place. He also mentioned the fact that on these really large-scale wildland fires, you can have up to 800 to 1,000 wildland firefighters trying to suppress that blaze. So that's going to be very difficult to put those restrictions in place, but they want to make sure that they are maintaining the safety of the personnel, and that is going to be critical for the long-term success for our suppression efforts for wildland fire, not just in Arizona, but across the Southwest.
Yeah, I've been to some of those camps where those firefighters live in very close quarters. All of that is going to have to change. Thanks so much for joining us, Wendy Smith-Reeve.